All right, well, it's a great pleasure to be here today and talk to you a little bit about what our center is doing that's across disciplines, and also identify maybe some new opportunities for multidisciplinary work that maybe some of you are interested in. ASSIST is funded by NSF. It's an ERC center. We are in our 7th year, and we are currently buried in reporting requirements that are due next week. All right, let me jump into it. For those of you who have not seen ASSIST's vision and goal before, we are really going after healthcare. As you may know, healthcare costs are a huge amount right now in the US, 17% of our GDP. Much of this is connected to chronic diseases, and Americans, typically as they age, have multiple chronic diseases. Another facet that's very interesting is the air quality, which we don't know that much about, but there is a connection between air quality and health. In asthma, it's obvious, but in other areas, there's also some growing evidence that air quality can affect cognition and cardiovascular disease. So with all of this expenditure by the US government on healthcare, the outcomes are actually not so good. Some of the latest data from the last couple of years actually shows that the life expectancy is going the other way in the US, and it's doing a downturn. And so this is really a problem. And so what do we do to get out of this trap? And there are lots of think tanks and lots of advisory boards, but in general, it boils down to we need better personalized health. We need to be able to get better at population health, predicting population health, and we also need to use digital technology and go with the concept of digital biomarkers that can help us explain and influence and even predict health outcomes for individuals. At the end of the day, we want all of this information to help us gain fundamental insight into how disease progresses. So let me walk you through what the major challenge is that we are trying to provide solutions for. So the current medicine, for the most part, this is not true in every discipline, for the most part, you have one general treatment that is applied to different populations, and you expect that the therapy on the left will work for everybody in your group. But that usually does not happen. Some of the members definitely have an improvement, but others either don't have any improvement or they actually get adverse effects. What we need is more personalized medicine, where you can individualize and customize treatment plans for different populations, different demographics, and then you can expect to get much better outcomes. So the way we get here is really by individual monitoring over long periods of time. And if we can enable individuals to, and give them technologies that they can use to monitor their own health, not just for a couple of days or a couple of months, but long term, then we can really start building a database of health for that particular individual. And also, this will identify trends within population health, so we can see these subgroups within the population subset that'll allow us to do much better population health. So in other words, individualizing monitoring of different health parameters not only helps the individual, but it also helps the population. So that is really the goal that we embarked on about 7 years ago. Our vision in the center is to build disruptive systems using research breakthroughs that create self-powered sensing, computing, and communication systems that can enable data-driven insights for a smart and healthy world. Our systems are unique because while you may already be wearing a wearable right now, our systems are self-powered. They don't need a battery. They work off of human body power. They have multiple sensors on them, not just your activity monitoring, but your physiological monitoring, environmental exposures, such as what are you getting exposed to when you go to a particular building, and even biochemical sensors. How is your lactate level or your other, some kind of a hormone level changing during your daily activities. These systems are wearable, wireless, and comfortable, and really the end of the day, it's the power that's coming out of this system is the data and what we do with the data. So our systems center is very top-down driven. So we are not a center where research technologies are just being developed for the sake of being very fantastic. We are really going after big problems. And so we have assembled a team of medical advisors and partners, and they have identified sort of these 5 use cases that have either a large number of people in the world being impacted by them, or they are very costly. And we have owned these use cases, and we're developing technologies to understand the solutions in this space. So for any of you electrical engineers in the audience, are any of you EEs in the audience? I don't see anybody. Oh, yes, hello. Hi, John. So this is our block diagram, and basically this block diagram may look very generic to you if you've seen these kinds of things before, but everything in green that you see here is something that Assist Center is developing in a disruptive way, whether it's supercapacitors to hold the energy that can outlast batteries, whether it's energy harvesters that can harvest power from the body, either using body heat or body motion, whether it's the actual chip that does the computing or the radios that send the signal out. All of the green blocks are being developed in the Assist Center. So, and then the data from the wearable node here on the left side is being sent to a smartphone or any other kind of device that you would like, and then there it's processed and sent to the cloud and so forth. So on the right side is pretty much a standard infrastructure that we plug into. The left side are all the disruptive technologies that we're developing. So I don't want to give all the details, I don't even have time to give all the details, but these are the general areas in which our technologies are coming into play. We are developing cutting-edge technologies, energy harvesting, in low-power circuits and radios, in non-invasive biochemical sensing, either using sweat or with some kind of minimal invasion with the needles, microneedles, using interstitial fluid. We are looking at materials, whether they're flexible polymers, stretchable polymers, or textiles, and then we are growing our effort on data in the last year or so. So here is an example of the different kinds of things that we have built using energy harvesting technologies. So whether it's a wrist device that you simply wear on your wrist and you walk around very normally, and it can gather power on the orders of hundreds of microwatts and dump it into a storage device like a supercapacitor, or whether it's a heat harvester device using thermoelectrics, or even if you're sitting in a room like this and there's Wi-Fi in the room or some kind of energy available in this room, we can harvest that as well using garments and integrating antennas inside garments. So here are some very exciting, very recent results. This is a thermoelectric wrist, almost wristband, but much wider. And it's placed on this student's arm. And you can see that when this person goes outside, the temperature difference between the student's arm and the air outside is a healthy amount, and it can generate over 1 milliwatt of power. 1 milliwatt of power is a huge amount of power for the kinds of systems that Assist is building. So with that kind of power, we can power up a variety of different sensors. But even indoors, where the person is not doing anything, there's still quite a bit of power that we can generate. So this is an example of the kind of work that we're doing with energy harvesting. In our ultra-low power chips as well, we are developing disruptive consumption, very, very low power consumption. And this work actually is being done at UVA, but we often collaborate with our circuit designers here on campus for new directions. But I won't go into too much of that here. Here is a work with our chemical engineering colleagues at NC State, where we have developed a microneedle patch here that goes under the skin to collect interstitial fluid. This fluid can then be evaluated for glucose or lactate or other kinds of biomarkers. We also have a sweat collection platform, and these platforms work together. Sweat is being collected for lactate, and interstitial fluid is being collected for glucose, and then the data is being analyzed. All right, and in flexible materials, we have a lot of exciting work going on. Of course, we have a huge presence at NC State in textiles, so we're taking advantage of that. So textiles integration, carbon nanotube heat sinks that are flexible and also have very high thermal conductivity, so it can be placed on top of thermoelectric devices to push the heat out. Small microneedle patches here that you can see, and then on here are some detailed images of textiles fibers that we have used to functionalize some of the sensor work. So with all of this research technology, our goal really is to go back to those use cases that I talked about, those health use cases. And so with our research technologies on the left, we integrate these in a variety of different formats, different form factors, different locations on the body to be able to address these use cases, like I said, asthma, vigilant atrial fibrillation, diabetes, actually specifically diet management for pre-diabetic individuals, and wound monitoring. So over the past several years, ASSIST has been busy in integrating all of these different kinds of technologies into systems that are doing something useful related to those use cases that I mentioned. So here is a flexible energy harvester device. Here is a chest patch that monitors ECG signals continuously. Here are some some electrodes that have been embroidered onto fabric for wound monitoring of uric acid. Here is our very cool, battery-free garment shirt that can measure ECG without the need for any batteries, but it's really provides vigilant monitoring. Here is our asthma monitoring watch that measures environmental toxins. Here is our, the watch has been designed in such a way that you can swap in and out different sensor boards. So whether you have a sensor board for an optical sensor for, let's say, heart rate, or you have a board for volatile organic compound sensing. So we have really worked hard to get from where we were in the very beginning, which was just a box of sensor, to this kind of platform that can allow you to plug and play different kinds of sensing modalities. And then here is our energy harvester of Wi-Fi that can generate 1 milliwatt of power just sitting around. So these are the different kinds of systems. I think in interest of time, I'll skip some of these slides and maybe talk more about the cross-disciplinary aspect of our research. So with our systems, especially our asthma monitoring systems, which are the most mature right now, we are working actively with clinicians at UNC. We have 9 IRB protocols that are being conducted, and we are testing these out in the clinical setting. The data that's coming out of these devices is being analyzed, algorithms are being developed, and most excitingly, we are publishing papers that have computer scientists, a pulmonologist, and electrical engineers working together. So this is, I think, some of the real outcomes and new learning that can happen when these different communities come together. Here is our ECG shirt, the one that doesn't need a battery. Here is Braden from Textiles, who's wearing this shirt, all developed here at NC State. And in this particular demo, the ECG signal looks noisy, but believe me, it looks very clean when we demoed it at the industry meeting a few months ago. But these are the various kinds of platforms that our textiles engineering colleagues are building that incorporate different sensing modalities and energy harvesting modalities as well. Let me move on, and I'll go on to, and this is just examples of the different systems we have built for a variety of use cases. I want to say a little bit about our industry program. Along with NSF supporting us, we also have industry members supporting us as in a membership scenario. And if you know any of these companies, you sort of know all the different disciplines that they come from, and they help us fill gaps and actually sponsor more of our research. We have been, because we are in this broad space, we have been inventing and commercializing some of our work. You can see some of the metrics there, but we are very pleased with the level of commercialization that we have been doing and the opportunities that are coming up. An ERC center also has a big education component, and so one aspect of that is an undergraduate minor that we have created in our program, and you can see that so far with 42 undergraduates data that we have, you can see all the different departments that are involved in our undergraduate minor. And not all of them are engineering. We have international studies, we have polymer chemistry, and medicine as well that's captured in a small sliver. And Greg specifically asked me to talk about perhaps some new directions that could involve different areas. And I was just put some thoughts together. I think, and these are mostly in health, but others as well. So in the area of brain sciences, maybe some of you are working in the brain sciences area, there is a lot of opportunity to use different kinds of technologies to understand brain stimulation, provided you can make these things wearable, non-invasive, even provide wireless stimulation and dynamically steer the stimulation beam. Lots of applications are there, for example, memory, understanding memory loss, Alzheimer's, drug abuse, epilepsy, and so on and so forth. And in this regard, I think this kind of field requires some advanced transducer design that can provide stimulation and manipulate it, that's integrated with electronics, smart packaging, and of course, low power operation. Pain monitoring is another huge area, especially with opioid abuse, and I think doctors really would like a way to monitor the patient's pain in an objective way, which is very difficult to do, but there are people working on this, and technology, sensing technology, especially bringing many different sensor modalities together and doing artificial intelligence, machine learning, you can understand perhaps some predictor of pain or some metric of pain. So what we need is a multi-sensor platform that's connected to pain, and we need continuous monitoring. So again, a lot of the, in our case, assist-like technologies play a role here. In implantables, there's also lots of opportunity, provided you can overcome the biggest barrier of implantables, which is energy requirements. You don't want to take out the device to change the battery, which is the case for pacemakers. So if you could provide energy wirelessly in an efficient way, especially for deeply implanted devices, that would be a huge breakthrough. And so that's definitely a research need, and biocompatibility with packaging materials is also a huge opportunity. And here are some things that we have worked on together with Profusa. Their implanted device is sitting under the skin. We have built devices that can receive the signal from under the skin. I'm out of time, so I wanted to just mention that, let me go here a little bit. In smart cities and smart homes, there's also opportunity for cross-disciplinary research. We feel that with our self-powered nodes, we can expand to IoT, monitor environmental exposures in buildings or in cities, but it also needs flexible materials, lots of data analysis, and security. So this is another growing area with lots of funding in the horizon. Plants, you may have heard about the Plant Sciences Initiative. I believe people are here from the Plant Sciences Initiative. And this is an area where some of the technologies NCC is developing are doing quite well, whether it's gas sensing or energy harvesting, lightweight, flexible materials. Data is another piece of this, and that's there. And then finally, animal health. That's another interesting area. Animals can't talk, so whatever we can do to sense what they're going through would be very enabling. And so I've listed the research requirements there. So I'll skip this. I wanted to show you this one interesting slide. This is our ASSIST team when we first started and where we are now. And I see a plot similar to this on a poster on this side. And the idea is, how are we capturing our interactions and our success of working together? So back in, when ASSIST was first established, 2012, we had these nodes of our PIs that are all over different disciplines and different universities. And as we grew into a center, we started building these nodes. You can see the lines, hopefully, and these lines are right now capturing only the publications, but you could build a similar chart capturing proposals submitted. And this is next year, the next year, and next year, and then I think this is the most recent one, which is still 2 years ago, showing all the different dense networks that we have created within the program. All right, so I've taken up my time. I'll just leave this slide up and happy to take a question or two, if there's time.
Your first slide showed, the issue in the U.S. of age and death going down.
Yeah.
And that this is sort of a response to that. And I'm just trying to think in terms of, do you have economists and social scientists involved in this in terms of determining which of these kinds of innovations could actually change that curve more than others in terms of where you invest in that?
Yeah, and that's a great suggestion. We don't have economists involved in our team right now, but in looking at some of the studies that have been published, majority of the chronic disease costs are connected to a few factors. One of them is excessive testing in the hospital, and this kind of technology could really help with that. And another one is readmissions into hospitals. So when somebody is released, they get readmitted, and that's a huge cost. So again, something like this would help monitor the patient once they are released. But I think there is a huge opportunity for economists and others to get involved and see what the real impact of this would be and what else we could do differently to lower the cost.
I just have one question about the life expectancy in the US is lower than other countries. Is that really, with that, is to evaluate all, I guess, is it?
That is not my plot.
Doing academic?
Oh, I don't know.
Because we have entire, towns in, let's say, Ohio that are 90% is high risk. Yeah.
I was just sitting there and I got a text saying that the opioid deaths are up by 1,000%
Yes.
just now.
Since last year.
Yeah.
Yeah.
Yeah, so that's a good point. I don't know exactly what has made the curve go down so dramatically in the last, I mean, it's already lower. It has been lower than other countries, but there's a very dramatic curve, downturn, but I'll find out. Yeah. Here, thank you.